Coronavirus. There is a mystery surrounding a new development about the coronavirus in the United States. Health officials say a man who was transferred to a hospital in Sacramento, California, has tested positive for COVID-19 without traveling to any of the countries hit by the outbreak. The Centers for Disease Control says it is unknown how this man became infected, the CDC adding he did not come into direct contact with anyone known to have contracted the virus or been exposed to it. So health officials are calling it potentially what they think it is the first case of the virus spreading in a community in the United States, community transmission. Complicating the case, the man was in the Sacramento hospital for 4 days before he was tested for coronavirus. Health officials in California are now trying to track down all the people who may have been in contact with him. Let's join our senior Washington editor, Lindsay Duncombe, who's looking at this part of this, sort of the politics of coronavirus. This has become a very potentially contentious issue for the Trump administration. What is the White House saying on this, Lindsay?
Yeah, contentious, Heather, because what does a community or a country need when you're dealing with a public health crisis? Obviously, it's a question of trust. And in the United States right now, there are a lot of people who do not trust the President of the United States. There are a lot of people who do not trust the media. So messaging is really important here. And we saw the White House go through a messaging exercise yesterday. Donald Trump held this rare press conference in the briefing room at the White House. He was surrounded by CDC officials, and this was a real effort to play down the situation or at least inspire calm and say things are under control. Donald Trump took credit for the fact that there are only 60 cases in the United States right now, saying that was because of his administration's decision to restrict air travel to China. Here's more of what the president said.
Because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads.
You heard the president say there, if it spreads. And we have heard from experts, including some of them that were right there with the president, that it will spread. And the disagreement in terms of the expert opinion and how the White House is framing this is the question of whether or not increased transmission is inevitable. Clearly, the White House doesn't want to say that. And they're talking about how this is something that is currently under control. The reality is there's just a whole lot we don't know about the virus. So the White House has put Vice President Mike Pence, the former governor of Indiana, in charge of all of this. Some confusion there, too, because former health officials are saying, well, who is really in charge? What's Mike Pence's role in trying to manage all of this? So there is a definite political element to it here. And although we may not have seen that directly from the president in the briefing room, we certainly felt it on his Twitter account yesterday, when the president blamed the fake news, the media, for blowing the situation out of proportion in a way that would spell panic on the stock markets, which we know really concerns the president because his main re-election strategy is all centered around the thriving economy. So as the information becomes more and more important for Americans to understand, it becomes tougher and tougher to sort of see through all the politics.
Lindsay, thank you very much. It's a really interesting situation for him, a challenge in Washington.